Hi guys, welcome to my video. In this video, I'll be clearly explaining about how the UPSC CMSE exam is going to be, and what are the tricks to clear this exam, what is the pattern of this exam, and what is the syllabi, and how to do well in this exam. Okay, let's go into the video. And as I have told you in the last video, like this exam is a calendar-based exam, so that every year we'll be able to know the date of the exam as early as possible in the starting of the year itself. So we can see a notification also is suggesting of some 700 posts they have been called for. So this exam is going to be for that 700 posts to get filled. The pattern of this exam is like paper 1 and paper 2. Paper 1 we are having a MCQ based test and paper 2 is a personality test. MCQ based in the previous years, few years the exam has been conducted in online mode, and few years the exam has been conducted in a offline mode, so that we'll be able to bubble on the OMR sheets. This MCQ based exam is conducted in 2 sessions. One session will be in the morning and one session will be in the evening. And coming to the marks, this is divided into part A, the MCQ based exam is for 500 marks, and part B, the personality test is for 100 marks. So that the minimum qualification, usually we won't be having any qualification marks for this part 1, that is a MCQ based exam, but there is a fixed qualification mark, that is personality test. If you are unable to get a marks of 40, then you won't be eligible even if you get a very good score in MCQ based exam. So target to be is to cross more than 40, basically go to cross the personality test. And this MCQ based exam will be for part 1 and part 2. The morning session which will be conducted for 2 hours, and the evening session is for 2 hours. Total exam is for 500 marks, and it will be divided into 250 marks and well as 250 marks. So 250 marks paper 1 will be included of general medicine as well as pediatrics, and the paper 2 is full of general surgery for 40 marks. For 40 MCQs they will give, and 40 MCQs for OBG and 40 MCQs for community medicine. And in the paper 1, general medicine for 96 MCQs, and next 24 MCQs will be for the pediatrics. So 120 MCQs for paper 1 in the morning session and 120 MCQs for the paper 2 in the evening session, 2 hours. So now it is so clear that the negative marking, which includes that 0.3 will be deducted if you do a mistake, and into 2 will be added by your correct answer. So according to this we have to manage, and the questions should be read properly is what the previous experts has been explaining on this exam. And what is the syllabus? The general medicine, which is the inclusion of all the major clinical branches, like the 96 questions which you have been expecting from general medicine will be definitely from the dermatology, radiology, microbiology, psychiatry, and all this will be included in the general medicine. And coming to the pediatrics will be the almost including the systems and everything. Exclusive pediatrics also will be there. And in the paper 2, general surgery will be including the ophthalmology and ENT, and obs and gynecology and community medicine will be continued according to their status. And what exactly some 8 to 9 years before, in UPSC CMSE they used to ask general knowledge questions. There will be some 20 general knowledge questions, and they used to ask and judge based on those questions, which were the very important factor in deciding. So after since few years they have been stopped asking these questions. And the general medicine, this includes the psychiatry questions. What everyone used to tell is like study final year exams, studying final year subjects will help you. Not exactly, but final year subjects will definitely help you. Why? Because the clinical orientation in this question paper, the questions based on the clinical orientation is very high. For example, there will be 240 questions given in this paper 1, paper 2. If we start dividing and distributing, like we will be getting some 40% single liners will be there, so that we will be able to answer just after seeing the questions. And the next 40 questions, there will be statements where we will be given some proper 2 to 3 statements, and they'll ask 1 to 3 correct, 3 to 1 2 correct, and all of them are correct. Such kind of questions will be for the next 40 questions. And coming to the next 40 questions, the questions will be very deep clinically oriented, so that you will be able to think and apply. And those questions will be measured from different subjects. For example, they'll correlate with the microbiology along with the medicine, and pharmacology along with the medicine. So these kinds of questions will be for 40 things, and some 50 questions will be pure clinical based, like what you will be seeing in the casualties and what you will practice in the wards. Those questions will be so clear. They will give a clinical history. After knowing the clinical history and parameters and investigations, so they'll ask you to diagnose almost some 200 to 250 questions everything will be so clear. And when you compare this exam and pattern along with the NEET PG, definitely you will feel like, okay, this exam is definitely a bit better and easy. So definitely you will feel that thing. Why? Because already if you start preparation for a NEET PG, then definitely this is going to be a easy exam for you. And coming to the sources, what I personally suggest is, if you are in a preparation for a NEET PG, then definitely this exam is going to be a cakewalk. When they have started excluding the general knowledge questions from this exam, and it's been so easy to clear for doctors to clear this exam due to the same syllabi. And so with sources which I personally suggest is, if most of the people will be having your Q banks, it be either Marrow or Prepladder or some Q banks which you have been following since day one. Continue with the same Q banks, but in that Q banks, what I prefer is use this PYQs so keenly, so that you will be able to revise them just before the exam. The PYQs from past 5 to 8 years, if you start doing those PYQs, if you do proper custom modules, including with the recent NEET PG, and keep on studying all the explanations which have been given for all the 3 to 4 options for every question which have been repeated questions. So keep revising those questions and know all the options and why they are included in those questions, so that you will be able to know each and every question so clearly. For that exam, if you get the same question from the next pattern, then definitely you can clear that with ease. So this should be a strategy. The PYQs are the main asset you will be able to find in most of the Q banks. And the second thing was, if you go to UPSC website, since there will be all the previous years questions, the PDFs will be available, and in some years they have provided even the key also. So it will be a bit easy. Just open the UPSC website, UPSC CMSE website, so that you will be able to get all the previous years question papers. So to give a mock exam, so that you will be able to know whether how much potential you are having to clear the question paper, how much questions have been correct, so that you will be able to assess what's the difficulty of level of the exam. And the other sources which already exclusively available for the UPSC CMSE exam includes, there are a few books which have been written by Dr. Prakash Naik, will having some previous year's question papers. They start in that book. You'll be able to see all the old question papers from 1999 to now, with solid answers, so that you can simply go through that book just before the exam. That will be very helpful for you. And Prasad's author name Prasad is also same kind of book you'll be getting. And Dr. Varun Agarwal, if there are no proper question banks, and in the last just 1 month before the exam, these books might help you. And what is the strategy? How to clear this exam? I'll be explaining the strategy, how to clear this exactly just 1 month before the exam, so that you'll be able to grasp it easily. But the strategy which should be like, already you have been started preparing for NEET PG. Why? Because this year NEET PG is on June 15th is what the NMC board has already announced the date. So the UPSC exam will be 1 month after the NEET PG. So if the exam is not going to be postponed, then the exam will be on June 15th, so that post exam will be having 1 month. That is ample of time to clear this exam. Why? Because already you will be in a peak preparation levels, so that if you don't give up and if you keep on continuing for the next 1 month, and that will help you to crack this CMSE exam as well. But if the exam is get postponed, then the competition levels for this exam will be definitely high. Why? Because everyone will treat it as a mock exam, so that the competition level and the cutoff level and the standards will be definitely high. The standards of this exam, especially the question paper setters of this exam will be conducted from almost the professors from the top institutes. For example, we have the Central Health Services will be including of Safdarjung, MMC, and Tamil hospitals from Delhi, so that these include other CHS. So faculty from there, they will be sitting for the personality test, and moreover they will be the question paper setters. So the question papers and standards will be almost equal to the NEET PG, but the thing is, the number of people writing this exam will be low when compared to the NEET PG. So less people, less competition, comparatively less standards for the CMSE, and obviously vice versa for the NEET PG. This is what happening. Personality test which you have to clear. The personality test is for 100 marks, so that 40 is the basic marks. If you get 39, and you will be out of the competition. So 40 will be the basic marks you have to score in the personality test. Then only you will be able to do this thing. So after writing this MCQ based exam, within a span of some 3 to 4 weeks, you will get your results. In that they will clearly mention your roll numbers. This year we are having 700 vacancies. So that nearly 2000 to 2100 people candidates. They will call for the personality test. This personality test almost every day some 30 to 60 people they'll interview. So this personality test almost will take for some 3 months of span. After 3 months of span, next month final merit list. So after the final merit list, actually for this personality test you have to go to Delhi, and the interview for you will be conducted in a UPSC Bhavan, just as IAS people are getting their interviews done, and you have to go with the certificates as well, with all the eligible certificates. Only after showing you'll be escorted for the interview chamber. In the interview chamber, there will be one IAS person and there will be 3 specialists. That specialist depends on their availability. They will be changing. In my experience, that day I have faced a physician, a pediatrician, and the person IAS will be asking almost the questions which, for example, for me, he asked what's a health setup in according to my local situation, and whatever the DAF you will be filling in the initial phases of the exam, that they will be having the DAF very clearly. So basically, the judgment in the personality test will be like they will clearly assess how the communication skills of you are, and what are the standards this fellow is having, especially in the subject. The other 3 specialists they will assess, and how confidently you are able to answer the questions, and to be an officer and to deal with some hypothetical situations, how should be whether you will be able to eligible or not. They will decide in a single interview. So that interview, that personality test will definitely play a key role. But the one trick is like if you are getting a very good MCQ score, if you are getting a below par, some 50, 60 also in the interpersonal test, that will compensate this thing, so that you will be able to get your rank up better. So our prime thing will be the MCQ based exam. So score as best as possible in the MCQ exam, so that the next personality test is going to be a bit smoother and attentionless. So thank you guys, and in the coming videos I'll be telling you about what is the salary you will be getting after selections, and after selections what cadre you will be allotted, and in that cadre how what are the perks, what the privileges, what is the accommodation, and how is the work culture pattern, everything in detail we'll discuss. Thank you guys.